Welcome back. It's Now with Dave Brown on AMI TV. The 2023 edition of the Maytree Foundation report was published last month. It found that the province of New Brunswick had the lowest social assistance rates in the entire country. Here to examine some of the findings is Shelley Petit. Shelley is the chair of the New Brunswick Coalition of Persons with Disabilities. Hey, good morning, Shelley.
Good morning, Dave.
Shelley, this requires a little bit of groundwork as a jumping off point. What households qualify for social assistance in the province?
So the way they do is they put us into like four categories or four houses, as they call it. They say that one is an unattached single. The other is unattached single with a disability. You can be single parent with one child or a couple with two children. What always stands out in these categories of people to qualify in New Brunswick is that there's absolutely no categories there to deal with a single parent with a child with a disability, either the parent or child, or a couple with disabilities, or a couple that has a child with a disability. Because, you know, people with disabilities, I guess, apparently they very systemically proving systemic ableism to us that we're not supposed to get married and we're not supposed to have children.
So the scope definitely reflects a narrow viewpoint of disability, even in the way the programs are structured. What are some of the individual findings in New Brunswick that stood out to you from the 2023 report?
Every time I look at this, my blood pressure rises more and more. It is terrible. So we see, again, New Brunswick's number one for all the wrong reasons. If I look around at our close by neighbors, in PEI, a single person with a disability would receive $18,715 a year. Nova Scotia, $12,867. Newfoundland, $20,400. So we get a whopping $10,884. And nowhere's within that do they account for the fact that it is 30 to 40% more expensive to live with a disability than without. And we wonder why people are struggling and starving to death.
Shelley, hit those numbers one more time, because that's four big numbers you just tossed out in pretty rapid succession. So just one more time, because I think that really drives the point home.
So in PEI, where the cost of living is lower than here, they would receive $18,715 per year. In Nova Scotia, whose cost of living is pretty similar to ours, unless you live directly in Halifax, it would be $12,867 per year. And in Newfoundland is $20,400 per year, and we get $10,884.
So what are some of the bigger implications as you look at those numbers and consider them? What do they imply to you in terms of the issues at hand?
Well, one of the big things, too, that if I go back to the previous question that really stood out in the report is if we look at the history, in 1990, a single person with a disability in New Brunswick was getting a little over $1,700. In 94, it dropped down to $1,200. 2018, $1,100, and now it's down to the $10,884. So our income is going down while cost of living is going up and up and up and up and up. And it just, you know, along with this, everything within this report, it shows that the government doesn't care and does not understand the plight of people with disabilities.
So what are some of the direct actions that need to be taken to address this?
Well, we keep telling the government this. So we say it's really important that they have, you know, a category for persons with disabilities within social assistance that is just for disability. As it is, 70% of people in New Brunswick who apply for the extended benefits, which is the name of our disability support program, are denied. So, you know, 70% of people with disabilities aren't getting $10,884. They're getting even less than that.
Wow.
They're getting like $9,800. Yeah, it's really bad. But they need to have a category just for people with disabilities, and they need to train the social workers on what our lives are, because they have no idea. I mean, I met with a social worker last week and one of our clients who's having a hard time, and they questioned why she would want to go out at night. Well, where do you need to go at night? Why would you go out at night? And I looked at her and said, how is that any of your business? Do you go out at night? Then why can't she go out at night? You know, like, so they want us to be treated like we have to be trapped in our homes outside of 8 to 5. We're allowed to leave for doctor's appointments. There's a complete lack of understanding of our needs. And that's not on the social workers. That's on the government and management who is not training their staff on our needs.
Yeah, you mentioned the number of people who aren't even having their applications processed. That's not just the New Brunswick issue. There was a story out of Saskatchewan a couple of months ago where their Auditor General found out that government agencies were not returning phone calls related to social assistance inquiries. And it wasn't just, a couple calls through the crack. It was like thousands of phone calls that were slipping through the cracks.
Yes. And they returning a call a month later. We can't even get a consistent answer on whether or not they can follow up after a meeting with an actionable list by email or snail mail. They can't even, every office is a different answer. And as I point out to government, if they can't agree on that, how would you expect them to follow this intentionally convoluted policy and make sure that consistent services are provided anywhere in New Brunswick?
Yeah, there's an understanding as to why there needs to be some bureaucracy in regards to keeping track of these things. Like, no one is saying eliminate paperwork. I think the argument here, though, is why do you make the paperwork so cumbersome that nobody understands? Well, you can go to a government website and try to read what they're presenting here to say what's the process to do this, and you read it for 20 minutes or 30 minutes, and then you realize, I was on the wrong webpage, right? And then you go to the new webpage, and now it's not anymore plain language. It's incredibly burdensome, not just social assistance. A lot of government programs become too difficult to access.
I must say it's something quite nice that Standards Canada, so the Accessibility Standards Canada under Phil Briscoe is working on, in its plain language policy. And they are trying to talk to the province of New Brunswick on that, because things should be written in plain language so that we get consistency. Because we always say, well, just call back tomorrow. They'll be wearing a different color underwear, and the answer will be different. And it's true. Like, it's terrible, but it's true, right? So they need to work on this, because when we don't have enough money to live, then people don't eat right. People live in unhealthy apartments and in mold and places with rats, and it's just disgusting. And then we get sicker because our immune systems are weaker, and then we end up in the hospital for long periods of time. And it just, they're paying the piper. They're paying way more than if they just allowed us to live and meet our needs and feel better, so that a lot of us could then go out and work even part-time without being punished and having health cards removed because we're working a few hours. It would make life better for everyone in the province. But we're treated like criminals. It's a couple of different policy solutions here. Number one is, let somebody, if they have the capacity to work for a couple hours a month and not deal with clawbacks on their social assistance. That's that's a really nice first step. But obviously, number two, Shelley, is just increasing the overall number, right? Making sure the number looks a little bit more in line with the cost of living. I know I'm kind of putting you on the spot with this, Shelley, so you can punt this away and tell me that I'm a jerk. But what do you think that number looks like? What's a better number? Or maybe one of the things that I always talk about is, can we tie a social assistance rate to the rate of inflation? So whatever the StatsCan number says, the social assistance number is going to move along with that on an annualized basis. But what's the approximate number that maybe you and your colleagues would be advocating for if given the opportunity? Well, I'd like to, how about we aim to hit the poverty line? Ooh, what a thought.
That seems like the bare minimum.
I mean, that would be more than doubling what we get to hit the poverty line. That's, people aren't asking to get rich. They want to just be able to live. So, find the poverty line, get us there. Then maybe account for the fact that we do know it's 30 to 40% more expensive. So take the poverty line, add a little bit to it, and then continue to increase that with the rate of inflation. Because we're going to end up healthier. We're going to end up more productive. We're going to be out in society spending that money that's going to bring it back in taxes. It's actually benefits the government to provide better income rates for people on assistance right now.
Shelley, thank you for this. Thank you for diving into some of these findings and talking about the implications.
Anytime, and I'm sure we can talk about it a million more times, because the report is very cumbersome and very deep. If you go in and read it, and anybody that needs to bring their blood pressure up, they should go read it.
Okay. Who needs blood pressure medication if you can just read this report?
Yeah.
Shelley, thank you for this. That's Shelley Petit, chair of the New Brunswick Coalition of Persons with Disabilities. Alex Smythe,